Okay, so right now we'll move on to the glenoid preparation of the TM reverse procedure. So first of all, you have your glenoid scraper, I don't know how you call it. So this part is actually quite sharp. So it looks like that. So this is for you to scrape off all the soft tissue, the labrium that is all around the glenoid. So once you have scraped it off, right, you can proceed on with your next tool, which is your positioning. This is where you want to position this. Normally you want to cover the bottom half. Yeah, bottom half as much as possible. You want it to be lower. You don't want to place it too high. There is a reason why, because right, if you place it too high and your base plate sits higher with your glenosphere, you're gonna have scapular notching. By scapular notching means when my arm swings down, the liner and the stem is gonna hit this part. So you want to prevent that, so you can place this as low as possible. You can make it flush or even slightly lower. This is really up to the surgeon. So once you're happy with the coverage of the base plate, right? If you look at it, this K wire here with threaded K wire, there is a black line here. Can you see it? Okay, so this black line is the indicator on how deep you are going to drill this pin through this hole. So when is my pin driver? Okay, just give me a second. So I'm gonna place it covered as much as possible. I'm gonna have this in here. Okay, now it's in. So this pin will be the center hole of the whole base plate, so I can remove this thing. So the next thing I will use is a 6.5 mm cortex breaker drill. So to fix these things in, right, you just look at it. There is some little groove here. There are some small holes here. Just make sure they go inside and sit on it. Okay, it's gonna be loose, so right, when you instruct the scrub nurse to pass to the surgeon, make sure they hold it upright so it doesn't come off. If you're going to do this, it's gonna, after a while, it's gonna drop. So this cortex drill is actually cannulated, which is helpful in this. So I'm gonna put this through here. Okay, probably I use power. It's my Hudson. That's all. Until it hits the bone, there's a stopper. That's all you can do. Don't force it in anymore. Once you have this hole, the next the next thing to do is your gold base plate reamer. This is the gold base plate reamer 1 according to the surgical technique. It's non-cannulated, so you will have to remove the K wire. So okay, can you use power at this point? You can, not an issue. But there is a very important thing to take note when you are doing this particular step. That is what we call the bloody smile. At this point of time, right, when you ream, you have to make sure that you see a bloody smile at this portion. What I mean by a bloody smile is, what it means is that after you ream, right, you will see blood oozing out from the lower half of the glenoid. And it looks like a very bloody smile. So if you look at it at this point of time, right, this is my cancellous bone, it will start bleeding. So the bloody smile will come out from here. Okay. So there is something called a Baseplate reema 2. So far in Singapore, we have not seen anyone using it yet. But if there's because normally the space is very tight within the glenoid already. They don't have and this tool is actually very bulky if you compare to this Baseplate reema one. So this is something that I guess they can skip if they want. So far in our experience here in Singapore, we have never used this. Okay, in. Okay, so now you have your base plate reema 2. The next thing is to prepare your gynosphere long post stem and then your screw direction. So in order to do that, you use this tool over here. You can place it there. Now these two things here will determine your screw direction. So normally for a left shoulder total reverse, we recommend it to put it at the 11 o'clock. If this is 12 o'clock, 1, 2, 3, put it at the 11 and 5 o'clock direction. Why is this so? This is because, right, the thickness of the bone for my screws to go in, engage in this direction, is the thickest at the 11 o'clock area and at the 5 o'clock area for the left shoulder. So if it's a right shoulder, it's on the reverse, which is 1 o'clock and 6 o'clock. Sorry, 1 o'clock and 7 o'clock. Sorry, 1 o'clock and 7 o'clock for the right shoulder. So this is the left one. We keep it at 11 to 5. So surgeon is happy with this particular direction. The next thing you need to use is the 7.5 mm drill that goes through here to prepare to drill so that you can have your long post of the glenosphere, long post of your base plate ready. So let me just fix up the instrument. Is it 11 to 5 o'clock direction? Now your long post is ready. Straight away you can, the surgeon will ask you to open the implant and then open the base plate for him. So this is the base plate that you can open, and the base plate impactor is this tool over here that you see have two little nipples here that fits into the two screw holes. So this doesn't lock. Okay, there's no locking mechanism in this, so be very careful. Pass them separately. Most of the time they will put this in like that themselves. Then you pass them this, and then for example a mallet so that they can lock it in. Okay?